Hello there, you are with Nyah Williams. I use she, her, hers as my pronouns, and I am here with Maeva from Codman Health Center. And over the next few weeks, we're going to be discussing what Codman is and what services that are being provided.
Hi, Nyah. Thanks for having me. My name is Maeva Veillard, and I'm the lead clinical navigator at the X Clinic at Codman Health Center.
Hi, Maeva.
Hi.
So today's topic is mental health services provided. And so I have a few more questions to ask that everyone's been wondering. So I'm going to start with my first question. What do you want people to know about your mental health services?
So I want folks to know that we have a very integrated behavioral health department here. So not only do we have the behavioral health department, but say you were to come into a visit to just see your doctor and you were to say, hey, I'm feeling like things are just not going well. Like, I don't know what's going on and I would really like to talk to a person. We actually have an on-call behavioral health person who could come in and talk to our patients because we know that mental health is incredibly important. And if anyone at any point were to say that they would like to speak to a behavioral health professional, they have the opportunity to do so.
Great. Thanks. And are mental health services available for outpatients and inpatients?
So mental health services are provided to, our patients here. So just because a patient, is seen in pediatrics doesn't mean that they wouldn't be able to be seen by a mental health professional here. It is definitely like a one-stop shop. So at any point in a visit, so whether it be like a visit with the X clinic or like a visit with a PCP, we do provide access to behavioral health to the folks who ask for it in our clinic.
Nice. Do you have any community partners with Codman Health that works at Codman Health Center?
I know that we are affiliated with Boston Medical Center. That is like very much like the hospital that we are affiliated with. I'm not too sure with other community partners, but in terms of a place that provides medical care to our patients, we are affiliated with Boston Medical Center.
Okay, great. That's nice to know. And lastly, are there any other services that you would like to talk about that we haven't already covered?
We have a substance use department too. And I don't know if we touched on that, but if a patient...
Briefly on it.
Sorry?
We touched briefly.
Oh, yeah. So if a patient during a visit specifically with the X clinic, a part of a question that I ask is if they would like to speak to a professional about their use. We also have the possibility to connect them to care with a person who could help them with their substance use. And I think that that's something that is of note because that is not the case at a lot of places.
It's not. And our community definitely needs that because people tend to forget about people who are recovering, who need those resources. And it's just mind-blowing that these services are being provided now because it's about time. It may have took a long time for these services to be provided, but I'm happy they're here and I'm happy they're staying here as well.
Yes. I think it's very, very important that we really take into account the people that we are serving in the lives of folks, right? Like, it's not easy to live life at times. And it's important that we take into account that a patient just doesn't come in to just get like a checkup, right? That they could also get a checkup, but if they want to speak to a person about their mental health or about their substance use, they also have the possibility to do that.
Nice. Thank you, Maeva.
Thank you, Nyah, for having me.
And that's all for this week's episode. Thank you for tuning in. And this is our last episode.